Hello, this is an educational video about fibroids of the uterus, and this is an educational video being presented by me, Dr. Dhanu, on behalf of Hindustan Healthcare Surgical Mumbai. Our main prerogative is to educate the women population about what their general problems are, and we do know that fibroids are one of the most common causes of the OPD complaints. So fibroids, as you know, can start off anywhere in the uterine wall. They're basically benign growths that start off in the uterine wall. And if you look at this picture, the fibroids usually start off in the wall, can be one or multiple in number, and they either stay in the wall or they could migrate into the uterine cavity or advance upwards or become serosal. So depending on the position of the fibroid, a patient could have different manifestations. So if we start off basically with intracavitary fibroids, such patients would normally have, or submucous fibroids, they would normally have heavy bleeding, they would have infertility issues, they would have severe cramping pain during their menses, and if a fibroid is aborting outside the vagina, then it would probably manifest as a mass in the vagina and some form of dyspareunia, which is painful intercourse or intermenstrual bleeding. The treatment for this is hysteroscopically resecting the fibroid and getting it off. Now coming to the fibroids in the muscle wall. The fibroids in the muscle wall can be one or multiple. Depending on their position and size and number, they could manifest, like an anterior large fibroid could manifest either with heavy bleeding or with urinary symptoms, which would be impinging on the base of the bladder. A posteriorly situated fibroid would probably give her a feeling of incomplete evacuation of the rectum, along with menstrual cramps or menstrual difficulties, along with heavy bleeding and or infertility. And subserosal fibroids that migrate up could either have a pedicle or could appear as a mass here, and depending on the size could manifest. Fibroids could vary in size, and the uterus could grow as large as almost a huge watermelon. And just last week we removed fibroids in the uterus almost weighing about 6 kilos. All treatments for fibroids are available at the Hinduja Healthcare Surgical Mumbai by the laparoscopic approach, and only very large and cannot be handled by the laparoscope. Though people say, oh, size does not matter, but there are times when you may have to surrender and do an open job to remove very large fibroids. But per se, fibroids are benign, they're not really malignant, they're very easy to tackle with good minimal access surgery.